Good evening. I am Dr. Kaushik Saha. I am a consultant pulmonologist practicing in Kolkata. So today I will discuss regarding stomach and acid imbalance. So in case of stomach and acid imbalance, the most common symptoms of patients are mainly chest pain. That's the burning pain. So when this type of problem occurs, so the patient usually came to us with the complaint of chest, that is the central chest pain. But the characteristic of chest pain, mainly that is a burning. They usually complain they are experiencing burning in the throat and also burning in the chest. Now, there are many causes of this type of burning chest pain. The most important cause is the lifestyle. So, if there is a problem in the lifestyle, if the patient is taking alcohols or spicy foods, or this can exacerbate this stomach acid imbalance. And the patient feels there is acidity and also there is chances of burning chest pain there. Second most important cause is the anxiety and stress, because in nowadays everyone in the workplace or in their home also there is stress and anxiety. So if there is presence of stress and anxiety, this also can trigger this type of stomach acid imbalance and thereby causing this chest pain, burning chest pain. Then certain medications, like the most common medications are analgesics, mainly the NSAID, or some antibiotics also can cause this acid-base imbalance, and by that, that is the burning chest pain. Some infection in the GI tract, mainly the H. pylori, may also cause this gastric problems or gastritis, and thereby causing this type of chest pain. And one of the most important factor is the addiction. So in case of smokers, they usually feels this type of chest pain very commonly, and smoking is one of the most important factor that can cause this acid burn in their chest. And also who regularly take alcohols, that can also cause this acid base imbalance. So what are the main symptoms of this type of acid base imbalance? Most important is the chest burn or heartburn, we can call it. Then the patient may experience regurgitation. So what the patient say, they say that there is food particles or some acid reflux coming into their mouth, and there may be abdominal pain, bloating may be there. The patient may complain that the patient is experiencing nausea and also vomiting there maybe. And if these symptoms persist for weeks or months, then there may be chances of weight loss. And sometimes the patient, if there is severe acid burn, sometimes the patient may cause dysphagia. So dysphagia may be there in a long-term basis. So if the patient is suffering from for weeks or months, there may be presence of dysphagia also. So this stomach acid imbalance may be associated with family history of upper GI malignancy, long-term dyspepsia, and also acid reflux can lead to other complications like iron deficiency anemia may be there, recurrent emesis or recurrent patient may complain recurrent episodes of vomiting. Then when there is recurrent episodes of vomiting or acid reflux, there is damage to the esophageal lining, and thereby can cause complications like Barrett's esophagus or esophageal cancer can occur. So inadequate nutrient absorption may also occur and causing essential vitamin deficiency and also mineral deficiency. So what is the impact of this acid imbalance in the digestive health? There is disruption of the stomach's acid environment, and that can impair and break down the mucosal lining, and also there is impairment in the digestion of the food, leading to gastric problems like bloating, indigestion, and forming of gas. An imbalance in stomach acid levels can contribute to dysbiosis in the gut microbiome, so thereby affecting the digestive function. And if there is chronic acid reflux, this can be associated with increased risk of developing conditions such as GI reflux diseases or GERD, gastroesophageal reflux diseases, and there may be formation of ulcer also. So that can lead to chronic gastric problems. So what you should do to prevent this acid-base imbalance in the stomach? First, adopting a balanced diet. That is very important. The diet should be rich in fiber, fruits, and vegetables. And you should avoid the spicy foods, should be avoided. Red meat also should be avoided. Secondly, stress management techniques, because nowadays everyone's lives are full of stress. So what you can do yogas daily, or can do meditation, to relieve the stress. And if it is not enough, then you can consult a clinical psychologist or psychiatrist also to relieve the stress, because stress is directly related to this acid burn or acid base imbalance. Third, addiction. So avoidance of addiction is very important, mainly the smoking cessation, and you can follow some smoking cessation techniques also. Secondly, alcohol regulation. It is better to stop any type of addiction, smoking or alcohol, to relieve these gastric symptoms. Then healthcare professional consultation is required regarding management strategies and medication, because if there is chronic problem of gastroesophageal reflux, and also if the patient is suffering from chronic gastric indigestion and also chronic gastritis, then you should consult a gastroenterologist or physician to relieve your symptoms. So this stomach acid imbalance has far-reaching clinical implication on digestive health, and proactive measures for prevention and management are warranted. Physicians and healthcare professionals can guide regarding the preventive measures and help detect the underlying causes. Improving digestive health confers metabolic impacts and aids in preventing chronic and metabolic diseases, and thereby enhancing the quality of life. So in a gist, this acid imbalance, stomach acid imbalance, mainly related to the lifestyle, that is the food ingestion, the addiction, that is the smoking and alcohol. Secondly, the stress, and lastly, antibiotics or regular intake of NSAID. So if you can avoid those practices by maintaining the lifestyle changes, then acid imbalance, stomach acid imbalance can be prevented, and other complications of stomach acid, long-term complications of stomach acid imbalance, that is the gastroesophageal reflux, also the peptic ulcer, esophageal cancer. So this can be avoided also. So this is in a nutshell what is this stomach acid imbalance all about, and how the patients usually presents to us with this acid base imbalance, that is the heartburn, indigestion, bloating, gas formation. These are the main symptoms of this disorder, and how to prevent that. And if the preventive medication does not help, then you should go to a consultant physician or gastroenterologist for treatment. Thank you. Now, in this stomach acid imbalance, there are many patients who actually help by maintaining lifestyle habits. So there is a patient few days back came to me having severe indigestion, severe bloating, and also he is experiencing nighttime awakening due to this acid reflux. When I take the history, he says that he is chain smoker, and also he having stress in his workplace. So I guide him how to stop this smoking, and also how to relieve the stress in his workplace by doing yogas, and also how to do meditation to relieve the stress. And after a few weeks of stop smoking cessation, and also by doing yogas and meditation, his symptoms like chest burn and also those acid refluxes relieves. And I usually add some proton pump inhibitor along with that. After a few weeks, when he visited to me, he says his all those symptoms relieved. And after a few weeks, I stopped the proton pump inhibitor, and only by maintaining the lifestyle habits, he's quite better now. So this is all about, that is this acid imbalance, and all those gastric symptoms are mainly lifestyle related. And if you can change your lifestyle, avoid addiction, avoid those taking analgesics without consultation with any physician, then this type of acid-base imbalance, stomach acid imbalance, and also this type of symptoms of acid burn, acidity, bloating, indigestion can be avoided. So this is my message to all my patients, that maintain your lifestyle, avoid any type of addiction. Thereby, you can prevent all those gastric upset and all those symptoms related to indigestion. Thank you.